This video gives a summary of the data collected by the Australia and New Zealand Dialysis and Transplant Registry, or ANZDATA, for the year of 2018 up to the 31st of December. It includes information about dialysis and kidney transplantation in Australia specifically, and was developed in collaboration with people with a lived experience of kidney disease. The Australia and New Zealand Dialysis and Transplant Registry, or ANZDATA, is an organisation that collects and reports information about kidney transplantation and dialysis in Australia and New Zealand. ANZDATA is based in Adelaide, Australia, at the South Australian Health and Medical Research Institute, or SAMRI. Each year, ANZDATA collects information about patients from renal units and hospitals, including patients' dates of birth, sex, residential postcode, and information about their health and treatment, for example, the cause of kidney disease or the type of dialysis the patient is receiving. Each year, ANZDATA then publishes a series of reports based on this collected data. These reports are used to ensure safety and quality of dialysis and kidney transplant services, for planning and evaluating health services, and to understand specific issues in kidney failure and its treatments. The information collected also helps inform research that aims to improve kidney health and treatments for patients. The ANZDATA reports and report chapters are publicly available on the ANZDATA website. Here we have a summary of dialysis and kidney transplantation in Australia to the end of 2018. Just under 3,000 people started dialysis in 2018 for kidney failure, and 1,149 received a transplant in that year, an increase of 40 patients compared to the number who received a transplant in 2017. Among the 4,000 or so people who started either dialysis or received a transplant, the main causes of kidney disease were diabetes, followed by glomerulonephritis, which are diseases involving inflammation of the kidney filters, high blood pressure, polycystic kidney disease, a genetic condition, and reflux nephropathy, a condition which causes damage to the kidneys by back pressure from the bladder due to faulty valves between the kidney and the bladder. There were over 13,000 people in total in Australia receiving dialysis at the end of 2018. Just over half of these people were receiving hemodialysis at a satellite dialysis unit, and 22% at a hospital dialysis unit. In total, there were over 12,000 people living with a kidney transplant. Over 1,000 kidney transplants were received in 2018 alone. 4 in 5 of these kidneys were from deceased donors, and 1 in 5 were from live donors. "118 people received a kidney transplant before starting dialysis. This is also called a preemptive transplant, and are usually from living kidney donors and done before a person needs to start dialysis. Of the people who started dialysis or received a kidney transplant in 2018, most of them were between 55 and 74 years old, followed by people 35 to 54 years old.